I would like to take your cooperation in welcoming Mr. Rajashekar Vodela, who is Managing Director, Nova's Design Build. A very special welcome to you on stage, sir.
What are the challenges involved in translating design intent to ground in the perspective of multiple components involved in the hospital construction? Because stakeholders are many, and the person trying to convert that dream into reality is one, and that's where the challenges lie. So your take, please.
Thank you, Doctor. Thank you, Brinda. That was a very good perspective on design. So what we're looking at here is who's going to build the cat. We all know the cat has to be built. And two very interesting things that came forward today is the form over function. So that should not be the case. And like Brinda said, the function always dominates. We are here for a purpose. We are trying to build a hospital to deliver healthcare. And the second point that Dr. Yash got out very well was in just in time. We hear that so much. We hear about this. The whole world runs on just in time today. You have to be on time. So I think the hospitals also have to be on time and have to be catering to the purpose that it is being designed for. That is where the challenge comes. Like Sir said, it's easier said than done. So the people on the ground contact people are the key to this whole process. We have excellent designers and administrators today coming up with a philosophy. A hospital is a very complex ecosystem today. It's probably one of the most complicated machinery, because you see in a hospital, we are dealing with the skill of the clinicians, the need of the patients, the compassion of your nursing staff, all the human emotions and needs that are being catered by a facility, a brick and mortar facility, which has highly critical and advanced equipment, which is very sensitive to any fluctuation and any kind of a humidity. And then we have so many of these processes that are coming in place today to deliver your healthcare faster. You have telemedicine. So much is being packed into a small hospital. And what we are trying to get this done is we are trying to get this complex design executed by a construction team who is probably not aware or equipped to be able to deliver this. So I think the focus should be on the understanding. I think all the stakeholders of the whole process of delivering a hospital have to come onto the same platter. The construction of a hospital is all about sequencing. It's about what comes first, next, and the follow-up. And it's also about just not finishing a sequence, but this work that has been completed has to be protected so that it is going to be validated in the future.
What is the future of the hospital in terms of increasing efficiency through scalability, sustainability, while keeping in view the cost that we just discussed?
Thank you, sir. It's a very interesting aspect of the whole thing, of being future ready. We've seen a very great example of adaptability and scalability during the COVID time. Probably India has done one of the best in terms of response, but I think that was a reactive tendency. We reacted to a situation and we did good. You would not know until you actually get the result out. So the future is about, and also the increasing population and the kind of advancements coming in technology, we are able to cater to a lot more patients today. Then how is the infrastructure going to be designed for this scalability part? So scalability is basically the efficiency or the ability to quickly increase your efficiency and capability to be able to take the patient load and deliver the same system more effectively. I think scalability is a twofold process. First would be the healthcare side and the process side. Second is the infra side. These are also two sides of a coin when it comes to healthcare infrastructure. When it comes to processes, the technology, leveraging technology, we've already seen transcriptioning, we've seen the electronic health records.
Are there any key top 5 pointers you would want to call out, which are the differentiators between one or the other kind of organization, with all due respects to startups or to established brands or international brands?
Thank you, ma'am. You actually gave us an opportunity to talk about our work. So I think, the basic question that as a procurement person, as a representative of the promoters in the hospital industry, is to think about the end in mind. That is, I think, one big thing that we have to look at. What is the purpose of our project? The time, the cost, and the parameters. So if you can define what is the time that you want, what is the cost and the parameters that you want, the agency that can actually take responsibility of delivering these three would be your choice of vendor. It can be an architect, it can be any of the vendors that you work with. Because mostly what we are doing is we are starting with the start in mind today. You want to start with the design. You want to onboard a contractor. You want to finalize a vendor. But are we really thinking about what is the end of it? So probably that should be the top pointer for all of us. So in general, when we start with an end in mind, that's when we get to a point much more effectively. And of course, there is other ways. Like today, it is not like a one-man job anywhere. So the collaborator, the integrator in your job is the key.
Thank you so much.
Thank you to
everybody.
our experts for sharing their expertise with us. Thank you, sir. Thank you, ma'am.